Welcome to Between Two Ovaries,
our women's health podcast,
where we'll be telling you the facts and debunking the myths.
We'll be keeping it chatty and casual, and you can follow us on Instagram at Between Two Ovaries.
Hello and welcome to our next episode, which is called Down There Care, Vulval and Vaginal Wellness. So this episode is all about knowledge, because knowledge is power, and unfortunately in the past the female genitalia has been kind of shrouded in myths and misconception and lots of shame, and that leads to barriers to accessing healthcare. And also it's just really important that we understand our own anatomy. Both men and women need to understand the female anatomy. So we wanted to kind of talk about what the vulva is, what the vagina is, how to look after it, what to do and what not to do. So do you want to take it away, Nick? With what is a vagina?
So I think this has come on the back of that you cannot still believe the amount of people that come to a gynecology clinic saying that they don't look right down there and they need something doing about it. And it really makes me sad, because I'm just like, what do you mean not right? Like, everybody's vulva looks so different. And we were discussing really recently about this wall of vaginas and wall of vulvas. That there's like a museum.
Yeah, so the Vagina Museum in London is definitely worth going to. It's been open for quite a few years now, and in there they have lots of different exhibits which are aimed at kind of empowering women to understand that their bodies are normal, even though they might look different to other people. And they have a wall of vaginas which are like real, live casts of people's vulvas, anonymously.
This sounds very fun.
You can go and have a look and see. And there's also another, if you can't get down to London, there's another really good resource called the Labia Library, which is a not-for-profit organisation called the Women's Health Victoria, have kind of like made this website, and on this website you can have a look at the labia library. So this has got like hundreds of pictures of women's vulva, so like from the front and then also from like the side, not the side, the bottom like view, bottom I guess.
View, yeah.
And it just shows you kind of like the real spread of like variation that there is in
I feel like honestly the real spread.
Oh my god. As soon as I said it, I was like, okay. It just shows you the real variation that there is in how people look down there. And it's just a really useful library to refer to and see if you feel like you are not normal, then you can look at that and it will show you that, yes, you most likely are.
I mean, on the whole, I feel like everybody is normal in inverted commas in an abnormal way. Like, labia aren't meant to be symmetrical. They're not meant to be non-existent. And I think it's really weird to think about it, but I think it is from porn that a lot of it that people kind of think, oh, it's normal to literally have no labia and have to be completely flat. And that's genuinely not normal. Like, potentially that's what happens when people get older and have vaginal atrophy and they lose the architecture of the vulva. And we do discuss previously that you can do something about that, but like the labia have a job, and it's normal to have labia. It's normal to have different size labia, that's the thing with porn specifically. You do often see one type of vulva because that's what's kind of like
it's definitely
seen
like
as
expectations and desirable things that are out there, when really that's like not a lot.
That's not what everyone looks like. Some people look like that normally, but I'd say most people don't. And that's why like the Labia Library and the Vagina Museum are really great, because it just shows resources. You these are normal women.
Definitely going to have a look at them.
Yeah.
I think,
should we start with like the basics, like what things are? Because some people might not know. Like, what is vagina? What is the vulva?
Confusion between vulva and vagina. A lot of people just say like, oh, my vagina.
Yeah.
And
yes.
That's all of the above. That's not your vagina.
No.
Well, it is.
So there's two different things, isn't there? And I think so you've got the vulva, which is the external, so it's everything. So the labia majora, which are the like bigger lips, the labia minora, the smaller lips, the clitoris, then like what we call the vestibule, which has the vagina, the urethra, everything there. That whole outside bit is the vulva. But people often refer to that as a vagina.
And you're like, it's not.
It's not, but it's very commonly misconstrued. And then the actual vagina is just the elastic muscular tube that connects the outside to the womb and to the neck of the womb. So it's just good to know what the differences are. And I think I am a real advocate for calling things what they actually are.
Yeah.
So I think it's important not to call a vulva a vagina, but equally I understand what you mean if you talk about
when it's
your
commonly
vagina.
said like that as well. I remember seeing I think it was on TikTok, and it was someone with a diagram of the whole area and showing men and getting them to write what they think was
labeling
different
it.
parts.
Brilliant.
And it was absolute chaos. I had absolutely no idea. But also, a lot of women might not know as well.
No. Some people are scared to look.
I think there was some kind of survey that said that like most women didn't realise that they'd got like a hole for a vagina and a hole for where your urethra, so where you wee out of. Like they just thought it was like one
All
and
the
the
same.
same.
Yeah.
Which kind of is mind blowing in one sense, but in the other sense, it's not like it's not on your arm. Like some people might
so
not
you
be able to
can't
see it.
actually
very
see it
not that
half
easily
an
accessed.
hour.
Yeah.
So I think it's important to know what you've got, what it is, what's normal for you, and when things are abnormal. So therefore, you can seek attention if needed.
I think because it's one of these things that's like really not discussed.
Yeah.
It's hard to know when something's normal or not normal.
Yeah.
And you might think, oh, other people don't have that. Is this abnormal?
Yeah.
A lot of the time, no, but there is certain things that are abnormal.
Yeah. I think that is a massive one. We have lots of people that come that will say that they've got discharge and therefore it's not normal. And you're like, no, discharge is completely normal. You should have it. It's healthy. And you have different amounts of discharge, different colours of discharge, different consistency of discharge. How many times can you say discharge? in different parts of your cycle.
Yeah.
But discharge is a good thing as an identifier of something being wrong as well.
It can be, yeah.
But for when you're trying to get pregnant, discharge is quite important for at certain times when you are ovulating, your discharge completely changes. So people can actually track their cycle on what their vaginal discharge is doing. And I think it kind of keeps you in tune with your body sometimes, especially if people aren't on hormones and this is kind of how they want to track. I think it is good to know.
Yeah, and we will do an episode kind of like back to basics, the menstrual cycle and the changes in your body, but just to kind of briefly talk about it for this episode, you do get changes in your discharge throughout the menstrual cycle, and generally speaking, sort of white, creamy, non-smelly, non-itchy discharge is normal.
Yep.
You might have more discharge around the time of ovulation, so it might be kind of more clear, there might be more of it, that's normal. Yep. And then after you've ovulated, you tend to have more kind of white or creamy discharge. Again, very normal. So if it's white, non-smelly, non-itchy or clear, probably nothing to worry about. But then you can have abnormal discharge as well. And I guess like what discharge is, so like your vagina maintains its own little microenvironment. The vagina's a little bit acidic, so the pH is kind of like 4.5, 5-ish.
There was something I read about this
previously.
So it's got the same as acidity as... Do you want to guess?
Yeah.
Or shall I tell you?
I was going to say battery, and I've no idea. That's like
That wasn't
corrosive.
on the
I was
list.
thinking like a lemon.
No,
lemon. Ooh.
No, it was beer.
Beer?
Oh,
Yeah. Red wine and tomatoes.
interesting.
Yeah.
Didn't know
I'd
that.
prefer
Fun fact.
the thought of red wine than beer.
I don't mind
Because
either.
I suppose slightly
acidic. So not as acidic as a battery.
Yeah.
lemon.
Or a lemon.
But something, again, that can throw off and change discharge is the pH. So if
Yes.
your pH isn't where it should be.
Yes, exactly. So that kind of like acidic pH microenvironment is what the vagina needs to be healthy. So it's full
So
of...
why is it acidic?
So because of the bacteria that kind of like predominate, so it's called lactobacillus. That's like the most abundant bacteria that's in your vagina.
Good bacteria.
Yeah.
Yeah, like with the gut, you have like healthy
Yeah.
bacteria and not so healthy. You want to have mostly lactobacillus, that's your friend, that will fight away all the kind of bad bacteria. But if your pH changes for some reason, and we'll talk through a few different ways that might happen, then you lose those good bacteria and you might be more likely to get kind of an overgrowth of bad bacteria. And that can lead to changes in your discharge. So you might have green, sticky, smelly discharge, or it might be kind of like watery, frothy sometimes, and it can be painful and itchy as well.
So if you have any of those kind of discharge, then you probably need to see somebody about it. They don't sound normal, and they can be caused by lots of different things. One of them, as you said, changing the pH, and changing that microenvironment of the vagina causes these problems, and that can be through lots of different things. Something as simple as antibiotics. So you've got a sore throat, you've had antibiotics, and then the next thing you're like, oh, I've got this weird vaginal discharge, and it's because the antibiotics will kill the good bacteria in lots of places, and especially if you run down, it can cause kind of a change in that microenvironment of your vagina.
I suppose if you're taking a tablet as well, it's your whole body. It's like not just localised.
Systemic effect, all of your body effect. So antibiotics can change the environment. Lots of things can change it, including kind of using different washers. So we've had lots of chats about this, because lots of people think that they need to kind of keep their vulva healthy by using these products, especially that are marketed for the vulva and
there's quite a
vagina.
lot out there,
Usually
isn't
quite
there?
expensive as well.
Yeah.
And like all unnecessary.
Completely
like I have a huge problem with all of these things, because the vagina is essentially self-cleaning. You only need to use water. You don't need to use any Femfresh or like Vagifem, is that a thing?
There's like
Also-
deodorant, sprays.
Also, like you just, and it just sells that message that like vulvas and vaginas are dirty. They need to be clean, and that's just really harmful. Like they're not. And if you over clean with these products that have perfume and soaps, you will then get problems.
People use it to try and think, it's going to smell better.
Yeah.
It can make you smell worse.
Yeah.
Because it can give
Absolutely.
you infections.
Yeah.
It's just really sad, because like that's what the media tells you need to do, and if you didn't ever think about it, you would believe them, and
I mean,
have Femfresh
you
wipes
need
everywhere.
to keep, you definitely need to keep clean, but you do not need to use products. And this is like a revolving topic of conversation that I have with various different
like
people
a pet
in my
peeve
life.
of every gynaecologist.
Yeah, I think so.
Don't
Like,
put
and
soap on
what
your
are
vulva.
you using? Seeing as though you have a red raw vulva. Well, I started with, and you're like, oh God, just bear it back. Like,
and on like cleaning, so douching is something that again can be harmful. So that's where you put water in the vagina. So
And sometimes like water and soap.
water and soap, like to go in and then clean the vagina, which you don't need to do for any reason. All that will do is wash your face. All that will do is just like change the pH, change your microenvironment, and then leave you more susceptible to having an overgrowth of bad bacteria that can cause problems. Yeah.
So, I suppose we need to maybe touch on what the discharges could be related to.
Yeah, the potential problems you can get.
Yeah.
There's definitely STIs are involved in changing discharge as well.
Yeah,
So
so
like-
sexually transmitted infections.
Chlamydia.
Yeah, chlamydia, gonorrhea. So there are sexually transmitted infections that can change your discharge. They are obviously sexually transmitted, so you would only have them if you've been having sex, and you can have tests for those to see if that's what you do have, and treatments as well. They don't always cause the same kind of discharge, but if you notice a difference, greenish, smelly, something you just don't feel is right, or you've got pain, then that would be something to go and consider having a STI
I think something
test
important
for.
to touch on as well is a lot of people think if they're sticking with the same partner all the time, they don't need to go and get tested. But it really is out there that you do need to get tested regularly, even if you're with the same partner.
Yeah, you don't know that.
Yeah.
You
Yeah.
don't actually.
hope
And
Well,
even
they're
if you
not
think
always.
completely not, it's better safe than sorry, because
Yeah.
there's complications that can occur if you're left untracked.
Definitely.
Complications with untracked chlamydia,
Yeah.
fertility complications
Definitely.
as well.
Yeah, if it's
Complications.
untreated, you can get
So it's
problems
definitely
getting pregnant in
like
the future.
get tested
Yeah.
a lot.
I was
Yeah.
I was totally going to highlight the same situation. Yes, we advocate for all of these contraceptions to help with your periods, and we say take them back to back, don't have periods. Like, I know what we've said on previous episodes, but we also definitely use contraception that is appropriate for the situation. So if you're with a new partner, no matter that you're using a hormonal contraception, you need to use condoms as well.
Yeah.
Until you've both been cleared, and you know that you're not going to catch an STI. Yeah.
And things, just touching on that, different lubricants and different spermicides can also cause changes in vaginal pH. So it's worth looking, because there's lots of like natural lubricants that you can buy. So have a look from that side rather than like a perfumed or like there's lots of various different ones.
This is also something that's like a bit TMI, but the thought as well that some people use saliva as a lubricant, that isn't great for, because the pH in your mouth is different to the pH there.
Not an ideal situation. You're better to just use like an actual lubricant that's
your
natural.
vagina does actually produce its own lubricant. So, if you're
to the
properly
vagina
aroused, you shouldn't need, well, not that you shouldn't need, but you might not need any lubricant, because that's, it's designed in a very good way.
Totally agree with that, but if you're going to use a lubricant, make sure that you're not using one that's kind of perfumed and that kind of thing, because we've just told you not to use washers, but then you're like, great, no washers. Oh, and yes, I'll have that. And you're like, no. Don't know who wants sourdough, but
perfume products in the vagina on the
Steer
vulva.
clear.
Just avoid it. Like, avoid as much. And period products, so like tampons, sanitary towels. Actually, we shouldn't even call them sanitary towels, because that again is the thing that implies that you're dirty and it needs to be clean. So there's a real shift towards calling them period products rather than sanitary products. But the fact that they are perfumed tells you that, your vagina smells when you're in your period, so you need to use these perfume products. But you try and avoid that. Use just plain,
as natural as possible. So we've said
so that's STIs.
So the other one that a lot of people get, and they get actually as part of the menstrual cycle, because just having a period changes your vaginal pH. So they don't know if it's the process of the bleeding or just the hormone imbalance that you have at that time of your cycle, but a lot of times people can be susceptible to infections at the time of their period. So it's worth kind of like looking out, do infections kind of stick with your period? Do you want to think about not having periods to try and enhance not having infections? But a lot of people can get thrush. So thrush is usually a thick white discharge, can be very, very itchy, and very easy to treat on the whole. There are some people that have resistant thrush and get it very often, but on the whole people will have it just as a one-off when they're run down or they've been taking antibiotics for something. And you can buy treatment for thrush over the counter, or you can see your GP and get treatment for
There's
thrush
multiple
as well.
types of treatments as well, isn't there, for thrush?
They're all based on the same kind of drug, but different ways of taking them. So you can have creams, and then you can have a pessary that goes in the vagina, and usually you do that at night time, and then it kind of dissolves overnight and treats the infection.
Is there oral tablets as well?
There is.
Yeah, but it's usually you go for topical.
You can get oral ones as well. Either probably oral or vaginal. You'd probably need both.
And if it's an
it's antifungal.
antifungal, so generally taking oral antifungals is not first line because it can affect your liver. So you're best off taking like topical first, or a pessary.
And if someone was unsure but thought they had thrush but didn't want to treat it, is there like a little test that you can do for it?
Just treat it if you're not sure. There's no harm in just treating it. And it's a clinical, like, if you came to hospital or to the GP, we wouldn't do a test to check. We can just say, that looks like thrush, and treat it off that. So
and if it gets better,
do the same thing for yourself.
And there's other conditions, isn't there, like bacterial vaginosis?
I was just going to mention on thrush as well, it's quite important to think about if you are having sex with your partner and you're not using condoms and you have thrush, then sometimes your partner might not have symptoms, but they might also have some thrush. And so you might need to treat your partner as well with just some topical cream on the penis.
So it's not classed as an STI?
No.
However, you should probably be...
It can be kind of, not every partner will have it, but you can kind of keep passing it back and forth.
So if you're somebody that's getting thrush all the time, then let's think about
Treat your
why
partner
you could
as
be
well.
getting it all the time. So bacterial vaginosis.
So that is another infection, but it's not a sexually transmitted infection. And again, it's so the kind of discharge that you typically get tends to be described as like a little fishy odour, and it's more watery. But again, I think it's really hard with these because if you think there's something different and you think there's a different smell and you're not sure, then probably just go and get it checked out. It's something that you can get a test for really easily. So if you go to a sexual health clinic or your GP, they can often just take a little sample of the discharge and check what the pH is. And if the pH is low, then that tells you that it's probably BV. and you can treat it really simply with a course of antibiotics. And then you might get thrush, so you might need some thrush treatment.
Bit of a vicious circle.
It's a balancing act.
Yeah.
I think that's kind of what we wanted to cover. Just
Yeah.
be like, look after it, don't look after it too much.
Yeah. Find that balance.
Find the balance. So we had some questions.
Yeah.
Yes.
Yeah, there were a lot of questions sort of around those products that we've already talked about, like people talking about going on holiday or going camping, you know, festivals, thinking, well, I'm doing something outdoorsy, or like I'm going to be sweaty, so surely I need to clean it more. Can your vagina and your vulva sort of compensate for itself?
That's a good question, isn't it? Because, like, yeah, we're talking about, you know, don't use soaps or douche when you're able to have a shower every day.
But definitely exactly, because we
Yeah.
stay clean, but
Yeah, and I would say, so I just don't think there's ever a good time, a good reason to use perfumed feminine hygiene products. I just don't think that they are good for you. They do cause a change in your microbiome and you're more likely to get problems. So avoid them,
Yeah,
even if
at
you're going
all costs.
camping. Yeah,
just trust her.
yeah.
She'll do her
That's
job.
Just quickly going back to, so there are tests to check for your vaginal microbiome, and you can get these like online, get the test kit sent to you, and you can look at your proportion of lactobacillus to see
Okay.
kind of if you've got a healthy vagina. And with respect to that, there are treatments for this, so you can kind of try and recolonize the vagina with healthy bacteria, a bit on the same sense as people do with their gut.
Yeah.
So there are oral and there are vaginal probiotics for your vagina, and there's evidence that they do get you back to a lactobacillus dominated vagina. So just something to think
Yeah,
about.
some people
Yeah.
might have thought about that.
That
yeah.
option, if you think.
I wouldn't say that you need to go out and get your microbiome tested.
No.
But, you know, if it's something that you've had done or
Something
like...
that you're really worrying about.
Yeah, I just think
Just good
that
to know
it's
more about
something we chatted before about at-home testing for things, and that's another
that's something
at-home
that's coming
testing.
out.
And I don't think it's like a bad thing. I don't think everybody needs to go and do it, but
Yeah.
also there are treatments if you do
Yeah.
have like a microbiome that's come back that's not lactobacillus dominated.
I think as well with this, the at-home testing, but also some people have at-home treatments that they think might work. Some things might work for different people, I don't know. But there's some odd ones I've seen online, and you've just got to be very careful what you're
Some old
putting up
wives'
there.
tales, yeah.
What have you seen
Yeah,
online?
someone put a garlic clove.
Oh,
Yeah,
I've
you
heard
told
of
me
that
that one.
before, yeah.
And I
That
just,
sounds gross.
yeah.
I mean, all in
it
two ways,
doesn't
really.
seem-
I mean, I know that garlic's meant to be really good for your immune system, but I
Yeah.
don't know how much that applies to sticking a clove up your
Yeah.
vagina.
It's a
But
bold
how'd you get
move.
it out?
Although I am happy to tell you that your vagina is a blind ending tube,
It
and it
is.
does not go anywhere.
Yeah.
So,
But a clove is very small and your vagina is larger than a clove.
yeah.
It might be
put
a
it
bit
in a
hard to get that
string
out.
to get it out.
Yeah.
That
as
and
well,
yogurt.
yogurt.
And,
Yogurt, yeah.
I feel like it's one of them that it's like, we can't say
Just don't
it's
do it.
never going to work because
Don't
we
do
don't
it.
know. But
Yeah.
it's
Steer
not.
clear. It's not what yogurt's
I mean,
No.
it kind of makes sense. Yogurt's kind of, you know, if you have a hot curry, you have some yogurt to cool it down.
This
I
is
can
not a
see
doctor
the
telling you to do
theory.
this.
But generally, no. Like, if you think you have thrush, just get yourself some thrush treatment.
Yeah.
And it's very, you can just buy it over the counter. It's very straightforward.
And if
Yeah.
one of the questions was, I've noticed some discharge, is this normal? Do I have an infection? Feel we've
We've
covered
kind of
that.
covered that, yeah.
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 And also, a big myth that I feel we all will have heard at some
Yeah.
point is, does eating pineapple and exotic fruits change the smell?
Yeah, I've heard this before. This is
Yeah,
often
it's kind of a high
related
school-
to...
Meant to, people say, oh,
thing.
it makes it smell or taste nicer.
Yeah.
But
I've
Go on,
never
have
heard
you
this.
found out if this
Well,
is true or false?
from what I've seen, it is false. However, some things that you eat do change the smell of your vagina.
Yeah.
But is it your vagina or is it your urine?
Never know.
Yeah.
Is it the
Because
microbiome?
because well, a lot of things that you eat do change the colour and smell of your urine.
Asparagus.
So I
Yeah.
wonder if
Yeah.
so I wonder if people
Mushy
are like
peas.
putting.
Bright green.
But I wonder if people are putting 2 and 2 together and making like 10. Like
Yeah.
with respect to like there's only one hole and there's only
Yeah,
like.
They're pretty
maybe.
close, things
I
like
guess
that.
we
yeah.
actually don't know the answer to that, do we?
Yeah.
No, we
So
don't know the
we could
answer,
look- we
but
could look
I
into
think
that.
extrapolating, I would kind of think that
Yeah.
maybe it's your
Yeah.
urine that changes and not your vagina.
Yeah.
But you don't need to eat like 10 pineapples to try and
No.
make your vagina
You get a
smell
fuzzy
better.
tongue because that does happen, doesn't it?
Yeah.
Burns.
Yeah.
And definitely don't put pineapple on your vulva.
No,
Please.
We're not recommending that.
not a good idea.
Do that.
Not recommended.
No. Do we have any myths?
I I think the main one that you mentioned at the start was like that they're dirty, they need to be cleaned, which is obviously totally not true.
Yeah, not true.
I guess part of the dirty thing is there's a lot of conceptions out there that hair is like a bad thing, it's dirty, it's not meant to be there, and obviously it grows naturally, so it must be normal.
Yes.
Again, that's like it is normal.
Yeah.
It's natural. It's healthy. It's a protective thing.
Yeah.
So, it does actually protect your vulva. It's up to you if you want to remove it or leave it there, personal preference. I'd say if you do remove it and then you're getting some vulval problems, then we generally advise maybe stop for a while, see if that improves things, because, shaving, using soaps on your vulva can cause irritation and soreness. But yeah, it's normal, it's healthy, and it is protective. But if you want to remove it, your choice.
As well, the myth
All
that
good.
all vaginas should be smooth.
Yeah.
But also,
And all vulvas, you mean?
yes.
Good
Yeah.
example, well
Proving
done.
this, yeah.
It's just so easy, isn't it? It's
I was about to
it's
say.
hard. Yeah.
I've read it off the sheet, and we've got vaginas on the sheet.
Yeah, we've got vulvas and vaginas.
Yeah,
Covering all bases there.
and that some lumps and bumps can be normal,
I
but
think this
also to be warned, that there's some bumps that might not be normal. If it's
Yeah.
blisters,
This is something that people come to clinic with a lot. Like, you might see someone who's felt a bump down there and thought, oh, I've never felt that before. That's not normal. Go to the doctor. And actually, it's just a normal part of your anatomy. Like, a big one is your hymen and the hymenal remnants. So, like, just kind of on the inside of your vagina is where the hymen is. And the hymen, big myth, it was never like, fully closing off your vagina. Even when you're born, it's like it is a little bit open. So your hymen is never just a fully closed door to your vagina, except when you've got a medical condition, which is quite rare but does exist. But when that changes, when you have sex, if you have a baby, then the remnants of the hymen can be bumpy and they can look different. And you might, if you've never looked down below and then suddenly you have a look, you might be like,
That is so
what is
strange.
that lump? I've never seen that before. So I think it's really important to just to actually know what you look like down below,
Yeah.
and then you'll know if something has changed.
Some changes can be.
People do it with like little
Yeah.
cysts as well, so you can have like a little spacious kind of cyst, so a little fluid-filled like area that will get bigger and smaller at different times. And I'm like, if it's not bothering you, then we don't need to rush and do anything about it. There are different things. People can get Bartholin's abscesses, so you have two glands at the bottom of your vagina, like two openings that can get blocked, and you can get really big, painful abscesses in those. You definitely need to be seen with that.
Yeah.
If it's causing you a problem, then see someone about it. If it's not really causing you a problem, probably don't need to see anybody about it.
I think
I would
another
agree.
thing as well is that people think that frequent sex can loosen the vagina.
Yeah, that's a good one. Not true.
And also that no sex, you can just heal up.
Well, I guess there's two parts to this, isn't there?
Yeah. Frequent sex doesn't loosen the vagina.
No.
I fundamentally will say that.
Definitely. It's elastic, it can stretch.
Yeah.
It doesn't
It's what
change.
it's
Certain
Yeah.
things like giving birth.
Yeah, so that will, because it's been stretched beyond what it usually is stretched, then potentially things could be not as tight as they were.
And it's also your pelvic floor.
Yeah.
I think it's really important to remember that with childbirth, it's actually your pelvic floor as well that gets, I guess it gets damaged, doesn't it? It's not as...
It's damaged whether you get cesarean or a
yeah,
normal
just being
delivery.
pregnant because of all that pressure. So, having a baby, there's massive physical changes. But in general, if you have sex, you're not going to loosen your vagina. If you have more sex, your vagina's not going to be looser.
Yeah.
That's a myth.
But on the flip side of that, when you said that if you don't use it, you'll lose it.
Yeah.
There is probably some truth to that, because when people are post-menopausal, if they're not looking after their vulva and vagina, so there is a degree of atrophy, so it's kind of
It's kind of shrinking
the
down.
tissues aren't as good. There's like some shrinkage, the elasticity, so the stretchiness isn't there anymore. Then people can kind of get a kind of, not a closing of the vagina, but it will be a smaller hole. It will be more uncomfortable if they were to have intercourse, more uncomfortable for like a smear. But you can use vaginal estrogen that would help that situation. And we do discuss that in a different podcast.
Yes.
I feel like just quickly going round and back to, we said about most vulvas, although people might not think that they look kind of normal in inverted commas, will completely be normal. And people still ask for surgery again and again. Surgery would include kind of making your labia smaller. And I just want to highlight massively that the complication rate from this is so big. Taking off some of your labia and kind of suturing it, it's in such a bad place to heal on the outside of your vulva. Loads of them break down and people again are not happy after that. So I think there's a lot of
more complications than it's worth sometimes.
Well, I think there's a lot of thinking about this before you had any kind of cosmetic procedure, because you need to think about long-term complications. You need to think about, are you actually going to be happy if you've had it done, and really think about like self-worth, self-love, like having a look at this wall of vaginas, wall of vulvas,
labia
library, and kind of trying to kind of work out what you do and don't need in life.
Yeah.
And
Learn
I think
to love your vulva.
Yeah.
Definitely.
Well, it's body dysmorphia, isn't it?
Yeah.
And so therefore you just think having that surgery, will it
actually improve things?
things?
And the other thing as well with, labiaplasty, and I mean, hopefully people realise this when they have it, but it would be terrifying if they didn't, that like you actually have a lot of sensation in like your labia minora and like the clitoral hood, and some of these surgeries will remove that completely, and then that kind of change how you enjoy sex for the rest of your life, which is terrifying.
The clitoral hood, some people don't like that. They think the clitoral hood is like protruding. That works, that kind of helps your stream of urination sometimes. So like you could then be in a position where you're not, well, you can urinate, but it's like spraying rather than in like a single kind of
I think that, there is a certain number of people that will have above normal size labia minora, and if it is affecting your life, if it's like really uncomfortable, there may be a place for surgery. And we're not saying that no one should have any surgery. It's just that generally speaking, a lot of women who want it actually have normal anatomy, and it's more that they've been shown and told that what's normal isn't normal, and that's what we want to try and fix, really.
I think that has kind of brought that to a nice closure. So next episode?
Yes, so our next episode is going to be going back to basics. So we're going to cover what the normal female anatomy is, the normal menstrual cycle, just giving you that essential information to understand what your reproductive system is doing. So please join us for that, and thank you for listening. And then please also follow us.
Between Two Ovaries on Instagram, and give us a review as well if you enjoyed this episode.
Thank you very much.
Thank you. So, quick disclaimer, all opinions and views expressed in the podcast are our own and are not affiliated with where we work. And information given shouldn't be taken as medical advice.
And you can follow us on Instagram at Between Two Ovaries.
And please follow us on wherever you are listening to our podcast.
Thank you.